I actually lived in what I refer to as like a veiled state for most of my life. I was desperate. I was feeling unseen by the industry that I was part of because I just felt like I was in a position where I was unable to be helped. I was very regularly, for most of my life, actually engaging in what's categorized as non-suicidal self-injurious behavior. And a lot of times when people are existing in that state, it's coming from a deeper, darker place. I got into a relationship that was very psychologically damaging. And then I woke up. I realized that if I am to have a better life, I have to do something different. I basically just went to Google and typed something like, how do I treat depression? And then one of the many things that popped up was ketamine. My first ketamine experience was actually intramuscular injection, and I was terrified. I mean, I'll even go before that and say that I was angry. That I felt like I had to do this. I was like resentful that my life circumstances put me on this path where I had to do it. It was a big emotional release for me. I did a lot of crying, healing type of tears.
Put on your nursing hat as a registered nurse. What does this mean to you that ketamine does this?
There's so much potential there for ketamine to just alter the end-of-life experience in a really good way, especially for patients who are experiencing lots of depression and anxiety at the end of life. There are a lot of different things in life that people go through but feel shame around. My aim really is to inspire others to speak on their experiences as well so that they don't feel alone either.
Lifting the veil, you're trusting yourself and you're giving yourself permission to help yourself in this way. Hello and welcome to another edition of the Healing Mindset Podcast with me, David Rabkin, talking about innovative, pioneering, breakthrough mental health treatments. Big hello to this week's guest, Seema Madhavan. She is a registered nurse. She's also a friend of mine and an old colleague when we used to both work together in inpatient psychiatry. So she's going to be talking about what it's like being a nurse and soon to be psychiatric nurse practitioner. And amazingly, Seema's also coming on the show today to talk about her experiences as a patient receiving clinical ketamine treatment for mental health. So Seema, it's so good to see you.
I'm doing great, and it's really wonderful to be here. Thank you for inviting me, David.
It's so good to see you. We both worked in a really tough place. You know, inpatient psychiatry is really stressful and tough. Whenever you walked into the unit, it was called Madison 5, Upper East Side of Manhattan. I'd always be like, Seema. Oh, thank God. Because my job as a social worker was discharging patients, working with families. And your role was super helpful just to reassure the family and the patient for once they were discharged. So thank you for helping me in a really difficult work environment.
And I have to say it goes both ways, because when I came on the unit and you were there, I knew that the patients that I was going to be taking onto service were going to be handed off in the best way.
Yeah, it was sacred work. And maybe as a first question, what was it like for you working in inpatient psychiatry? I know you're not working that space now, and nor am I, but it was, for me, it was possibly the best training, working with patients that are mainly suicidal or manic or psychotic, or they've just had an overdose. So for me, it was life-changing. It really was, especially being in kind of the Upper East Side, Harlem part of Manhattan with all the different kinds of people there. It taught me a lot. I just literally landed in America. So it made me who I am as a social worker, with compassion, but also with, I think, the family systems approach. So that's me. What were some of your lessons of learning to work in that inpatient psychiatric setting?
The biggest part of my role was really coordinating home care for them after those patients were discharged. And that was a whole different lens of nursing than any lens that I had had up until that point. So I really was confronted with a lot of the realities of what happens after patients get discharged from the hospital, what needs to be done to prevent them from coming back, and how complex does that look? You know, it can be very complicated to make sure all the pieces are in a row. And then no matter what, you know, sometimes your best efforts just don't work out in the end. So understanding that too.
That's a really good point. It was such a challenging environment, and ultimately not knowing what happens to the patients when they leave, when you hand it over. But a lot of them stay in my mind. I remember a lot of their stories and experiences, and it was a special time. Okay, so onwards. This is a special time because it's your first ever podcast. So my first question is, when I messaged you on LinkedIn and WhatsApp and we were talking about this, why did you say yes? I'd love to do it, David.
It was just, it's exciting. And I'm at a point in my life, I think, where I'm willing to learn by doing. And I'm trying to embrace not having everything perfect before actually doing something, actively combating a perfectionistic mindset. So this is part of that. It's just, this is an exciting opportunity that someone that I trust has presented me with. And so why not? Why not take the chance and say yes and try something that I've never tried before in a very safe way with someone safe.
So you're breaking a taboo, or in a sense, you are part of the changing of the narrative around mental health, particularly for Indian women. What is the reason that you wanted to talk about your own experiences with mental health and working with ketamine? What particularly is inspiring?
What's inspiring me is I feel like there are a lot of different things in life that people go through but feel shame around. Actually, as a matter of fact, I had a conversation earlier today with a colleague of mine who is menopausal, and she was sharing with me how no one talks about it. It's only now that in this day and age where all these startups are coming up, to discuss this topic that our parents never discussed with each other or with us or with their friends. It's always just been hidden under the carpets. So it's inspiring. And it's also, I think, just really important to know that none of us are alone in our struggles. And I think that by trying to be the voice, my aim really is to inspire others to speak on their experiences as well, so that they don't feel alone either.
That's what we're here for. That's literally the healing mindset, is around having those conversations that most people would ignore, but they're really important, particularly ones that there's shame around. So depression and trauma and suicidality, but also things like menopause. We had a guest on, Melissa Whippo, a month or so ago, and she's doing research around women's mental health and psychedelics. She's got a research study that's IRB approved, particularly looking at, I think, perimenopausal women's microdosing of San Pedro, because microdosing seems to be really effective for women in their menstruation or menopause or perimenopause. So but it doesn't get much media attention, but it's really important because it affects your quality of life. So your quality of life, let's just paint a picture for me, Seema, and for folks that are listening and watching. Before ketamine came into the picture, what was it that you were noticing in the early days around mental health, around your inner dialogue, and what started to become apparent to you?
What was apparent to me was how, by whatever metric I was being measured with or measured by, I somehow remained subclinical. I was never diagnosed with some of the things that I kind of knew that I had, like complex PTSD, or I was not diagnosed at the time, but I came to be diagnosed at a later time by somebody else who maybe did it differently or had a different picture of me or something. But I was really desperate. I was feeling unseen by the industry that I was part of, because I just felt like I was in a position where I was unable to be helped. I was very regularly, for most of my life, actually engaging in what's categorized as non-suicidal self-injurious behavior. And a lot of times when people are existing in that state, it's coming from a deeper, darker place, but their actions may not demonstrate that to someone assessing or evaluating them. So I really was hurting deeply for a long time when I came across ketamine as a therapeutic modality.
Thank you so much for sharing here, being vulnerable with those experiences early days. And there's something about being subclinical and what's normal. What do we expect? What do we want from life? How should I feel? And it's so unique and personal, but also internal. So maybe just zooming into your inner world, Seema, internally, what were you noticing was happening maybe with your inner dialogue, but also with your awareness within yourself about what I need, what I am hoping can change, and what I need to do to, take responsibility for my mental health in order to feel better, for things to change? What was that process and journey like around that point of time?
I actually lived in what I refer to as like a veiled state for most of my life, just kind of accepting what other folks were telling me as far as, I'm okay. I have a roof over my head. I have clothes on my back. So everything's fine. There's no reason to be sad. There's no reason to be depressed. And then further to that, I have a lot of trauma around not being believed, because in my culture of origin, the person who speaks out against what they've endured is the one with the problem. It's not everyone around them that perpetuated the problem or the societal structures that perpetuate the problem. So I struggled with that, but I also had the mindset of, no one else seems to have this problem, so I'm just going to keep my mouth shut and keep suffering. I just kept living that way, in a veiled way, thinking that I had done my best by just going to talk therapists for 20 plus years. And then what happened was I got into a relationship that was very psychologically damaging. And then I woke up. That relationship really the ending of that relationship woke me up to the fact that the reason that relationship had even gone as far as it had was because the pathway, the runway for that had been laid by my family of origin. So I was trained to accept certain levels of abuse, and I was trained to tolerate certain behaviors that maybe other people in different families didn't. So when I woke up to that reality, I realized that if I am to have a better life, I have to do something different.
That was amazing, just sharing that part of your journey. Thank you, Seema. And that must have felt scary, but also empowering. And the idea of lifting the veil, like there was this veil around, like, oh, it's just me, I'm the only one. And that internalization, to lift that fear and scare, it's being, in that place of, oh gosh, can I do this? What do I do exactly? So what started to happen next as you decided to start lifting that veil? What was some of your next steps?
Actually, one of the first steps is a step that I'm still taking every single day, which is acceptance. Because it's really hard to even accept that I was in an abusive relationship. Like, that doesn't happen to people like me. People just kind of delude themselves into thinking that they can never experience these type of things. But and then it happens, and then it's like this shock. Like, how can I trust myself now? So I guess just accepting that it happened, accepting that I survived it, accepting that I have power within me to change what I accept in my life so I can move forward in a different, more fulfilling way, on a path with more light and more hope on it. So that's really a big ongoing piece of the puzzle, is just acceptance. Acceptance that I need the help of a medicine like ketamine to carry on,
This is really powerful hearing you speak like this, Seema. As a friend, I'm really happy we're catching up. It's also awesome that other people get to listen in on the chat. But yeah, I'm so happy that you've lifted the veil and that you're bringing in so much acceptance, you're trusting yourself, and you're giving yourself permission to help yourself in this way. As a friend, it's awesome to hear, and as a mental health professional, it's inspiring to hear someone loving themselves that deeply and taking responsibility. And like you're saying, every day, reminding myself of these things are true. Yeah, and we're all integrating into being human in life. All right, so breathing that in, love it. Next steps, what did ketamine look like when you first saw it? So how much did you know? I don't know if it came up a bit in your work, if you were familiar with it, if you were kind of keeping track of the psychedelic news, but when did ketamine arrive in your kind of inbox as something that could be helpful for you?
I'm also going to add that when all of this was happening and the veil was getting lifted, it was right when the pandemic started. So I think a lot of other people were also having struggles with their mental health. So I basically just went to Google and typed something like, how do I treat depression? How do I treat myself after an abusive relationship? I must have Googled some phrase or words like that. And then one of the many things that popped up was ketamine. And so that was really the first time that I came across it. I hadn't come across it in a professional way at all. Had no idea. I'd heard maybe of psychedelic stuff, but I never was curious about it or knew anything about it until then.
And do you remember if there was something in particular that felt like that would be particularly suitable for you? Because you're saying you were kind of Googling around, how to transition and move on from abusive relationship. Was there something around your inexperience or that you wanted ketamine particularly to help you with?
I think it was more of some of the things that I read about how effective it is with treating depression and PTSD. And so I was curious about what really goes behind that statement. Maybe it's something that I can experience too. And also, I had this huge level of hesitancy to take a traditional SSRI. I did try Wellbutrin. I took that for a year, but I was never willing to take an SSRI because of the side effects associated with it. I just never wanted to take that kind of risk myself. So I opted for a psychedelic intervention instead.
One thing I should say to everyone, Seema is not a patient of ours at MAPA Minds, which is part of this podcast, The Healing Mindset. So, we're not talking to you as a patient. We're talking to you as a person and the experiences you've had working with other ketamine providers. And you've had a few different routes of administration, which means the way that the ketamine gets into your body, and work with a few different providers. So you've actually got amazing experience at knowing the different ways that ketamine feels and how it helps in different ways. So do you remember your first ketamine experience?
Yes. I was very enthusiastic to answer that. Yeah, I remember it. And I will say that kind of what you were saying, Dave, is that none of the ketamine I ever took was outside of a clinic or none of it was ever outside of protocol. So it was always in a regulated environment, administered by licensed professionals. So my first ketamine experience was actually intramuscular injection, and I was terrified. I mean, I'll even go before that and say that I was angry. I was angry that I felt like I had to do this treatment, and it was not cheap. And I was like resentful that my life circumstances to put me on this path where I had to do it. So I really didn't have a good feeling about it. Actually, at the time, I had to take money out of one of my brokerage accounts. So I was very unhappy at what I felt was needing to do that. So I went into the clinic, and then I was terrified to get an intramuscular injection because I was thinking, what if something happens? What if I have a negative reaction? What if I stop breathing? How do you know you're giving me the right dose? Medication errors happen all the time. I also at the time was working for a company that specialized in medical malpractice. And a huge reason for medical malpractice in the US is medication, not being administered the way that it's prescribed. So I was paranoid about that, worried about being vulnerable in a facility with strangers who didn't know me. So I had a lot of that kind of emotional journey. And then during the actual journey itself, I think the anxiety just manifested in a lot of tears. So I did a lot of crying, loud crying. It was a big emotional release for me, especially coming out of what I had just come out of. And I think that I was so distraught that it concerned the team that was providing care for me. But they were very understanding. They were nurturing. They were supportive. And I never had a session quite that scary ever again.
Wow. Thank you again. I'm going to keep saying thank you throughout this conversation. Thanks for sharing that, Seema. So part of the lifting of the veil was also letting out a lot that had been held in. And it sounded quite somatic as well. Like you're saying, crying, kind of, making sounds and just letting it out. And that might have been scary and challenging and like, can I do this? And what's happening? What do you feel like looking back that ketamine has enabled you to start to feel differently within yourself and about yourself?
I would say trust. A big part of receiving ketamine as a medicine is the preparation going into it, because the intention is very important. Your mindset going into it is very important. So after that first treatment being so scary to me, I really had to lean into some of the ideas of like trusting myself, especially after having had this abusive relationship that I never thought I would be in. How could I trust myself? So I had to really prioritize that as my first intention. And that led me to have better experiences in subsequent sessions.
Yeah, intention is really crucial. So you invest quite a bit of energy mentally and emotionally into figuring out how to get the most out of this. But I love at the beginning you were saying there was also anger. Why do I have to do this? Like, this is expensive. There must be something, I don't want to project onto you, but there must be something really wrong with me if I'm getting injected with this drug. But the opposite of that's also true. Wow, I must love myself so much to do something that's painful and scary and expensive. And I'm doing it because I love myself and I want to lift the veil and let this out. So that's the trust there. You're seeing the trust literally being released. Wow. In your ability to care for yourself. Yeah.
I never actually felt, and what I'm about to share actually added more to my frustration and maybe led to some resentment, because I never felt like there was anything wrong with me. I never felt like there was some defect in me that the ketamine or any other medicine was going to fix. And I'm glad I never felt that way. But what that meant is that I was resentful that the folks that hurt me were not the ones getting the treatment. They were not the ones seeking this help. And I wouldn't have been in the situation I was in if those other people had gone and gotten the help that they needed. So that was my feeling.
Thanks for clarifying that. Wow. So you've been doing some really, really important work within yourself. I'd love to hear, because you've had experiences with ketamine using different routes of administration, and because you're a nurse and soon to be psych nurse practitioner, how do they differ? And what are your thoughts around how different routes of administration might help different patients in different ways?
So the first route I had was intramuscular, as I shared. And then after that, I'll share that I did a protocol of 6 treatments. And then probably about 8 months later, because ketamine has it's only effective for a short time frame. So after about 8 months, I felt myself sliding back into some of my old thought patterns and thought that I would benefit from another protocol. So I went to another administration center, and then I got intranasal treatments, and I got another protocol of 6 treatments. And it was a little less intense. The thing is that at that time, I really wasn't even sure about dosing across different routes. So I can't even tell you if I got a bigger dose. I'm not sure. But it was a different experience because it was less of an acute experience than the IM was. For the IM protocol, I needed to be in the center for 2 to 3 hours or longer. And for the intranasal, it was really capped at about 2 hours that I was held at the clinic afterwards.
Yeah, and interesting that IM intramuscular, it's a powerful experience right at the beginning, and then it stays high and then goes down from there. Whereas I think with the nasal spray, it's not as powerful, not as intense a peak. But so maybe that's good, following on from those really high experiences, just to go a bit deeper, integrating. And I like the subtlety, the lubrication of the soul, of the mind, to then move into that kind of little dance within yourself, picking up on those subtle signals. And I think now you're getting intravenous IV ketamine at a clinic in Manhattan. So how does that IV clinical ketamine compare?
It's a much different experience than the other 2 routes of administration because it's much more acutely effective. There's a much larger acute impact, and I'm kept in the clinic for much longer. It's really as long as I request to stay, and I always request to stay for a long time because it feels like such a safe space. The staff is so warm and inviting, and they're all just really wonderful people. So I feel safe when I'm there. So I try to make it as long of an experience as I can. And it's intense. It can be intense depending on my mindset, depending on what I'm experiencing. It can be pretty intense. And I have still had treatments where a lot of tears were released, but they were therapeutic tears. They were not tears being terrified of the unknown. It was more like, healing type of tears.
I love that we are able to have tears in so many different ways, but they're all good for us to let out. Thank you. It's great, again, that you're giving yourself the time to stay in that clinic, in that safe place, not to feel rushed, just to say, I deserve this. I'm going to make the most of this experience. So I'd love to know, what do you do during a ketamine session? There's been stories online that a few of my friends are sharing about. People are like, going onto Amazon and just buying loads of stuff in like a psychedelic state, and during their ketamine journey, waiting in the clinic, and they're like, oh, that looks nice, I'll buy that. Other people, they do some deep meditation, put on some amazing music. They do some journaling. Maybe they call someone in their family and have a heart-to-heart chat with them. So what do you do when you're having your sessions? How do you like to spend the time to make the most of it?
I have had different ways that I've spent sessions. Actually, in the past, interesting you mentioned the phone calls, because in the past I have been on the phone with people during my sessions, but I didn't feel like I got the most out of my sessions when I did that. The way that I get the most out of my session is by using the tools that the administration center has available, which are light blocking, like an eye mask, and headphones for really high quality sound. And they play wonderful playlists. I prefer playlists that don't have any human voices in them. And they have, I just experienced a second playlist that was just instrumentals, and it was really wonderful because, you just go all kinds of places in the universe with something like that. So that's how I spend my session. And then the chair that they have you in is It has a zero gravity aspect to it. So you just hit a button and it reclines where your body feels like it's floating. And then they give a weighted blanket. So very cozy, warm.
So now I know why you like to stay there as long as possible. It sounds like it's a vacation
It's a little
in a
bit
way,
of a brain.
but it's not necessarily like an easy, light, fluffy one. You're doing some meaningful work,
Yes.
and sometimes there's those tears, but
Yes.
it sounds awesome.
It's a little bit of a brain vacation.
And you're going for, this is maintenance therapy. So how do you conceptualize ketamine as a maintenance therapy? So going to the clinic, however often you need to, how does it fit into your life as a kind of ongoing maintenance experience?
I go about once a month. I know that there are people who go much more frequently than that. I don't want to do that. Primarily, I don't have the time to do that. Also, once a month seems to be a good pace for me because if I go much longer than that, I start to feel an impact in a way that I don't want to feel an impact. So this prevents me from getting to a very dark place. And I have spaced it out in the past where it wasn't 4 weeks. It was more like 5 or 6 weeks. So I can do that too. And I may do that at some point in the future when the time feels right for me. But actually the 1 month maintenance treatment was something that my therapist suggested to me.
I love that part of that experience of the maintenance dosing is knowing when it's the kind of the Goldilocks sweet spot, not too soon and not too far, and you can trust yourself with that and give yourself permission. I want you to put on your nursing hat as a registered nurse and as a soon-to-be psychiatric nurse practitioner. What does this mean to you? That there's this thing called ketamine and there's all these different routes of administration and it affects the brain in this way and it helps people to heal in this way. What does that mean to you as a medical, particularly mental health professional?
So what that means to me is that there are so many ways that this medicine can impact people, and there's so much potential there. So when I think about how my patients could be treated, I mean, there's so many different ways to go about treating them. And I also think about the education aspect, because I think it is a very misunderstood, under-acknowledged treatment. There's a lot of education that needs to go out for, I think people would really be able to accept it more than they do now. Because it can be really scary to get really any of these routes of administration, because once you put it in the system, you really can't take it back. I guess teaching someone that they can expect a certain duration of being under the influence of the medicine, that could be potentially a hurdle, but also welcome for some people. So that's kind of where my mind goes with that.
Yeah, and I'm hearing some of that answer tapping into your current role, working around quality in education. So some of that could be, the protocol itself. Is it giving patients the best experience they could possibly have, educating the patient, but also the team around protocol and patient experience, and just those, I think as a nurse, those touch points of caring for your patient. Having worked in 3 different hospitals, nurses are incredible at caring and showing that care, sometimes holding a hand, just letting a patient cry, being there when they're going through difficult experiences, and sometimes doing the really kind of dirty stuff around vomit and defecation and blood and all that stuff. Really amazing work as a nurse. So talk to me a wee bit from that perspective as a really caring, supportive, present nurse who's focusing on the patient experience, helping them open to ketamine to get the most from it. What are some of your thoughts and hopes around how you can maybe one day help patients with ketamine themselves?
There's so much potential there for ketamine to just alter the end of life experience in a really good way, especially for patients who are experiencing lots of depression and anxiety at the end of life. And something that we know is that a lot of folks that struggled with depression, anxiety, and other psychiatric diagnoses earlier in life, those conditions tend to resurface at the end of life, even if they had been treated. So I guess just being in a position to be able to provide that type of comfort on a higher level with the use of ketamine as a treatment would be really amazing. And like you said, Dave, I don't know how far in the future something like that is. There's a lot of potential there, and something I can consider as I make my way through my educational journey.
Yeah, honestly, I've seen, and there's been a lot of research in the past around end-of-life care and psychedelic assisted therapy, but also patients that have cancer and they've got depression and anxiety, facing mortality, asking those more existential questions. And there's some great work, particularly Sunstone Therapies, which is in Maryland, doing some incredible work. Bill Richards is down there. But yeah, life and death is inevitable, and it's sacred, process and opportunity for meaning making and establishing of relationships, and in a sense creating this more ceremonial rite of passage that psychedelics and plant medicines have been doing for thousands of years in all different kinds of traditions and rites of passage. I'd love us just to talk a wee bit around life and death. There really seems to be something necessary around facing that in a meaningful way. Almost like you were talking about lifting the veil earlier, Seema. Being real, like what's there? How do I feel about my life? What have I experienced? What happened? What didn't happen? What am I leaving behind? And what do I need to accept? So just any thoughts around that piece with mortality and our kind of existential reality as humans?
It's so big for so many reasons. It's, all of us have our belief systems that we were raised in, and during the course of our lives on this big rock flying in the universe, those perspectives might change. We might find things during the course of our lives that challenge, what we were raised with. And that can lead to some conflict at the end of life for sure, because we just don't know what's next until we get there. So that's probably the first thing I think about when I think about an existential crisis and just worrying about what's next. That's one big part of it. Another thing that comes to mind is a fear about letting go to what's next, fear about leaving behind loved ones. So, that's certainly a big part of things as well. So what we do at our company is really try to have those conversations while folks are still alert and oriented and able to engage in those conversations. And we try to get the unsaid to become said whenever possible. And a lot of hidden family secrets that might have been hidden for decades, might be revealed at that stage as well. Lots of resentments can start to show, lots of long hidden resentments can start to show, and forgiveness is a possibility, but sometimes it's not. So kind of just grappling with that reality of how finite we each are, and really what's possible with our time, and really bringing, as you mentioned earlier, bringing quality of life to the time left.
That's a really good answer. Lots there. I'd almost like to do another episode just about that. When you said making sure that the unsaid is said, that's so important. It's so powerful on a personal level, but for a family and for relationships. And again, lifting the veil, acceptance, trust, the unknown. Yeah, there's something really powerful there. Thank you, Seema. So the unknown, the future. How, as a final question, Seema, how do you hope, as a practitioner in the mental health space and as someone with experience of healing using psychedelics, how do you hope that in the future the mental health infrastructure, systems, and profession can successfully include ketamine and other psychedelics like MDMA and psilocybin alongside things like SSRIs and SNRIs? What would be your kind of ideal vision for how this would work, particularly as a professional?
The first thing that comes to mind is affordability and accessibility, because SSRIs are being they're very highly accessible to all kinds of people in different socioeconomic status. And I think I would be really interested in getting into some work towards making ketamine and other psychedelic medicines more accessible and available to folks who can't currently afford them. I do recognize as a patient that I was privileged to be able to afford it. And so I really have a lot of reverence for that fact. And I want to do my part as best I can to bring it to others who may not have the access.
Brilliant. That sounds really clear. That's so important to you. Thank you, Seema. So before we say goodbye, it's been just lovely to catch up. We should do this again, and maybe just the two of us, not everyone else listening. But thank you again a million times over for sharing. It's really inspiring. And for folks that have felt inspired listening and watching, that want to reach out and learn more, where would you like them to connect with you?
Yes, absolutely. I'm definitely open for any conversations about this, about these topics. And I'm reachable at Seema Madhavan at gmail.com. That's my first and last name, SeemaMadhavan at gmail.com. And also I'm reachable on LinkedIn.
All right. Thank you, Seema. And thank you everyone for listening to another really beautiful episode of The Healing Mindset. We'll see you next time. This is David Rabkin with Seema Madhavan.
Thank you.
God bless. Thanks, Seema.